I really don't have a typical day, I think is the exciting part about it. Generally what my day involves is coming in. I usually clear out my work inbox because often a lot of the GPs will be asking clinical questions, and I try and get to those as quickly as I can. So I try and respond to those early in the morning. And then I would generally see 3 patients in a day. Typically those are in the patient's home, so I space those out. And so I'd see the patient for say 45 minutes to an hour in their home, and then I'll spend probably an hour writing the notes up as a report to the GP. And so I'll do that for 2 or 3 patients in a day. And in the afternoon, it really depends on what I've got coming up. So I might be getting phone calls from some GPs asking particular questions like I just had recently, or I might be developing an education session for them. We have a doctor's meeting once a month, which before that I present therapeutics on a therapeutic topic. So one of the topics has been around a new anticoagulant, so I present information on that. And they value that because it's non-biased information, so it's not like the information they get from a drug company. It's been researched, and I try and make it interactive and those sorts of things. And we've had greater attendance at the GP meetings now because there are people coming to those education sessions. So I chair a quality improvement committee within the medical centre, and we look at ways which we can improve the quality of healthcare within here. And so we've got a number of things. We've looked at closing the gap for Aboriginal and Torres Strait Islander people. We've looked at a thing called collaborative waves, which is set out under the primary healthcare collaboratives. Most recently we've looked at COPD. I'm involved in a COPD clinic that we run here, so a patient would see the GP nurse and myself focusing on COPD management. I run clinical prescribing audits for the GPs, which we collect data on how they're prescribing for a particular disease. I then present that back to them, provide them with some education, and then re-audit again later, and see if there's been any change or any improvement in prescribing for that particular disease. I help take some of the medical students when I visit patients, and then pharmacy students and sometimes nursing students. I'm sure I do some other things that I'm forgetting.